Welcome to Next to Madison, a podcast to help you live your best life.
Welcome back to another episode of Next to Madison. I'm your host, Madison Malloy, and on this episode, we are sitting down with world-renowned New York City plastic surgeon, Dr. Joshua Zuckerman. I am so excited to talk to him. He is somebody that has actually worked on my face. No, I don't have surgery on my face, but I do love microneedling, radiofrequency treatments, and Botox. So this is my new go-to guy. He is the holy grail. He's amazing. And I feel there's a lot of confusion about how to stay young, which procedures to do, where to go. And so this is a great episode. We're breaking down everything from collagen supplements, if they work, Botox, how often to do it, all the different types of Botox, how to prevent skin aging, what's the best skincare routine. We talk about the impacts of surgery. It is chocked full of information. So if you're a human being that wants to look younger than your age, well, this episode's for you. And I think that's probably 99.9% of you. So definitely check out this episode, and we will be right back after this brief message from, my book. You got to buy my book because it's time to lighten the fuck up, people. So we'll be right back with our guest on Next to Madison.
Hey, it's Madison Malloy. Just wanted to remind you to make sure you grab a copy of my book, Time to Lighten the Fuck Up. It is a great, funny self-help book that is going to help you get out of your own way. I have already helped thousands and thousands of people, and they are on their way to living their dream life. And I want every listener to be able to live their dream life as well. So grab a copy of the book on Amazon, Barnes & Noble, or even the audiobook on Audible. Now back to the show.
Back with our amazing guest on this episode focused on skincare and anti-aging. I have got top New York City plastic surgeon with me, Dr. Joshua Zuckerman. I'm so excited. How are you?
I'm great. I'm excited too. Thanks for having me, Madison. This is gonna be a lot of fun.
Oh my gosh, I love it. And you guys, I didn't just grab him out of a dictionary or out of a directory. I literally he's done some radio frequency on my face, and it's been amazing. So I want to start with that because the radio frequency treatments, which are all the rage, they make your skin glow, they tighten, but there's a lot of them out there.
Yeah.
And so I want you to kind of go through what that does and why you chose the one you did on me, the secret one, because I did Morpheus and that was the worst thing I'd ever done.
I'm with you on that one. Yeah. So as with any of this stuff, there's a lot of noise and there's a lot of crap out there. And even among the things that work, like radio frequency microneedling, like what we did with you, there are choices and some are better than others. You know, in my thinking, in my practice, I'm not a big device guy. I don't go and chuck 200 grand on a piece of equipment just because I'm very careful about what I bring into what I do. And I want to make sure that it works and does things and makes people happy. So we actually, before I bought one of these, I trialed, I think, basically everything out there. So we had the guys from Inmo, that's the Morpheus one, the Lutronic Genius, the Potenza, I think there are the Vivace, and then this guy, the Secret Pro from Cutera. We had them all in here and did them on each other and did them on our friends and patient volunteers and the entire staff, and tried to filter out what we liked. And this one was far and away the best. So what the technology is, it's a machine, obviously, with a handpiece with an array of very fine needles that penetrate to whatever depth we set and then fire off a pulse of energy. And what that does, it stimulates collagen synthesis and collagen remodeling, and it's very, very effective. And you can use it on any skin type. Unlike a laser where, you're resurfacing the skin and it can do things like pigment the skin. It can do strange color things, especially if you have darker skin. You can use this on any skin type. So that said, this Secret Pro offered a combination of, it was the most comfortable and gave kind of the most immediate and best result, kind of in my mind. And I had 4 or 5 of them done to myself, done to my own face. I kind of wanted to see what it felt like.
Yeah.
I didn't try Morpheus. I did that to my victim, Sarah. She's my nurse, and she was just like, get that thing away from me. Which is not, she's not unique. I mean, listening to you anyway. So Morpheus is the one that the Kardashians tried out and posted about. So now everybody, you mean like Morpheus? So yes, sort of it's similar technology, but just better. It's more comfortable. It's more effective. And we do it to a lot of people. It's become very popular.
Yeah, no, it is good because I was somebody who did Morpheus, not with you, but back in January, and it was the most painful thing I'd ever done. My face was like blown up right here for probably 7 to 10 days, so you couldn't really go outside. The amount of drugs I had to take just to get through it was terrible. But this one, the secret one,
Yeah.
it was numbing cream, and that was it. There was no
Yeah.
Vicodin, there was no lidocaine injections. It was so much better.
Right. There shouldn't have to be any of that stuff. Yeah, we do topical numbing for like an hour. Hang out, drink a glass of champagne in the waiting room, and just do it. And then afterward, pink for, I mean, how long were you pink for?
Less than 24 hours.
Yeah. It's you're better by the next day. There's no downtime. There's no worries about sun exposure. It's just so easy and it works.
Yeah.
And
No, and I would absolutely recommend it after doing, like, I did Vivace, and there wasn't a lot of downtime with that, and the pain was minimal, but the results were nothing.
Right. Yeah, that's the thing. I mean, so we're trying to hit the sweet spot of like, does something and doesn't hurt,
Yeah. No, absolutely. Okay, so let's talk about like aging in general, because everybody wants to be younger, and let's talk about real quick. I want to go into collagen supplements because you're seeing this everywhere. Do they work by ingesting them or not?
I mean, so there's not a whole lot of evidence out there. Yes, this stuff is popular. And I mean, collagen is just a protein. It's a family of proteins that make up kind of the building blocks of you, whether it's bone, whether it's skin, whether it's cartilage. And yeah, so what happens if you eat it or dissolve it in a tea and drink it? The answer is not that much. So there's a study out there, a collection of studies which show that, like, okay, yeah, maybe people saw a little bit of an improvement in skin texture, a little bit of improvement in fine lines and wrinkles. But it's not really a great quality study. And the bottom line is you're better off just putting on sunscreen. Your money is better spent just protecting yourself from the sun and moisturizing. So yeah, sure, go drink some collagen, but you're probably wasting your money. There are better things you can do.
Okay, that's good to know, because like the vital proteins, people are putting it in their coffee. The only reason I like the vital proteins wasn't even the collagen. It was the fact that you could actually get protein in your coffee, which was good for muscle growth.
Sure. I mean, there's nothing wrong with it. You're not hurting yourself. I mean, it might help a little bit, but you're better off going to GNC and getting a protein supplement if you really want to do that.
Yeah. No, that makes sense. So how do we delay the aging as much as possible? Is it just sunscreen?
That's the biggest single thing you can do. So I always tell people, a regular regimen of Botox and sunscreen will keep you looking young for a long time. And especially if you start Botox early, so you don't form those deep lines, then yeah, you'll have smooth baby skin for a long time. So that's kind of the basics. That said, skincare should be easy. And there is so much noise out there. There's so much,
Yes.
There's so much crap, and it is a multi-billion dollar industry, and you can just spend a ton of money on some of this stuff, and most of it doesn't do a whole lot. In terms of preventing the aging process and like what you can do for skincare at home, really simple. So 4 steps in my book. Wash your face twice a day. So just basic cleansing. You don't have to spend a lot of money on a cleanser, just like something it's fairly gentle, that's not going to be oil producing, but like I say, you don't have to spend a lot of money, but morning and night. So you have bacteria on your pillow, which you make your skin grungy in the morning, and then just obviously just like living life, in my case, walking around New York City, yes, there are all kinds of pollutants and gross things in the air that get on your skin. So yeah, wash your face. Number 2, moisturize. So moisturizing, again, you don't have to spend $400 on a thing of La Mer from Bergdorf Goodman. Like Eucerin's fine. You want to take a step up from that and just, something with hyaluronic acid in it. HA is great. It's very hydrating. So moisturizer with an HA, and you don't have to spend a lot of money. Moisturizing keeps your skin obviously, hydrated, but also just helps you maintain the barrier of the skin to protect you from the nasty things out in the environment. So moisturize, and then obviously it's sunscreen. So that's, the single biggest anti-aging thing. I could say it I'm blue in the face. Yeah, put on an SPF every day. It should be at least 40 to 50. Especially if you're pale like me or slightly less pale like you. So it's a good strong SPF just every day in the morning before you walk out. That's what I do. I like the Elta MD stuff, which is also like not that expensive. You usually have to go to a doctor's office to get it, but a little pump of it is like $40 and it'll last you for months and months. And it's doesn't form this like thick gross stuff on your skin. It works really well. So sunscreen, and then if you want to do like one like kind of next level thing, probably a retinol. So do a retinol, and then you do that at night. So what retinols do, and there's good scientific literature to support this, it increases cell turnover. So retinols kind of make you clear out all the bad stuff. So it's great for acne, for fine lines, for wrinkles, and just helps your skin renew itself. The thing about retinol is they're inactivated by UV light. So that's something you don't want to put on in the morning, because like just being out in the sun will just like render it useless.
Yeah.
So retinol at night. So yeah, kind of those four things, just super simple, just wash your face, moisturize it, put on an SPF, and maybe do a retinol at night. You do that, you're going to be pretty good for a while. Also, like, don't smoke, things like that. But just basic stuff, and you'll be looking pretty good for a while generally.
Okay, so retinol, yes, you hear all that all the time, but there are a lot of retinols. Do you recommend getting it from a pharmacist?
I don't get it from a pharmacist. I mean, I would recommend medical grade stuff.
Yeah.
You don't have to get a prescription necessarily. But the one we sell in my office is Elastin. SkinCeuticals does a nice one. Skin Medica does nice products, and they all have some version of a retinol, and they come in different percentages. Start with a low. They are a little bit irritating, so start with like kind of a low percentage. Make sure you can tolerate it. Make sure it's not making your face peel off, and then kind of ramp up. But yeah, go to a doctor's office and get something with a name on it, and get something that's decent. But you don't have to get a prescription. It's not that crazy.
Okay, perfect. And then how often should you be putting this on at night? Every night or?
Yeah, I do every night.
Every night. Okay.
Every night, unless you're like post procedure, like unless you're like post laser or post RF microneedling, something like that, then you want to back off stuff that's going to be potentially irritant to the skin.
Yeah.
But as just kind of a regular thing, doing like a 0.5% retinol every night, love it.
You'll be good. So Here's the other thing: should you be putting it under your eye?
You gotta be careful under the eye. It's super, super thin skin. If you're gonna do one, I would do a low percentage. There are some good eye creams out there. I like the eye creams that have caffeine in them. Caffeine is a vasoconstrictor. It makes the little blood vessels contract. And applied as a topical and absorbing through that super thin skin under your eye can help with those dark circles. It's not going to make them go away completely. But people who have kind of chronic inflammation around the eye, which kind of brings me to another question, actually. So I see so many people come to see me with that dark circle and say, Doc, can you shoot some filler under there? I hate my under eye circles. Hate it. Filler under the eyes generally doesn't help.
Okay.
Unless you have a real hollow there, which some people do, but very few people who are like your age and my age have true hollowing under the eye. So unless you have something to fill, don't put filler there. But that dark circle is often a combination of just chronic inflammation and skin pigmentation. Skin pigment you can't do a whole lot about, but the chronic inflammation is usually just like irritants and environmental allergies. So you're just allergic to pollen and dust and just things that are out there, and just having that go unrecognized for a long time will make your eyes chronically a little bit puffy and a little bit purple. And so, doing an eye cream that makes the blood vessels constrict will calm down that purple. And then you kind of adjacent to that, doing an antihistamine eye drop, like Pataday or Patanol. And those used to be prescription. They're over the counter now. And it's just like a 1 drop once a day. Bang, bang, do it in the morning as part of your thing. And yeah, a couple weeks, it'll chill out your dark circles. So,
interesting. But what about fine lines and wrinkles? That seems to be a bigger concern.
So fine lines and wrinkles, it depends. Eyelid skin is sensitive. I'm a big fan of Botox under the eye, actually. small dose Botox into the eyelid underneath the lash line. I have fairly fresh Botox in my own face, so I can't, when I do it, I don't form the lines too much. But a lot of people, when they scrunch up, you get those crow's feet lines out here. We also form this roll underneath the lash and form that just like little crinkle. Just doing 2 to 3 units of Botox directly under the lash line. And this is something you should go to somebody who knows what they're doing with Botox and knows they're doing injecting. You don't want your average, esthetician in a med spa shooting under your lash line. But like the technique is important here, but it's like a whiff of Botox, tiny amount, like 3 units per side, ... and it'll smooth out a lot of that wrinkling, that crepiness under there. Other things that you can do, like non-invasive, non-surgical stuff. I like lasers under the eye. And we'll add that on to facial surgery a lot, where we'll do, we put special eye protectors over the eye itself, and then we can get right up to the lash line and do just like a CO2 resurfacing laser, which, if you're awake, it's uncomfortable, but if you're asleep, who cares? And what that does is kind of peel off a layer of skin on the surface, and you just form beautiful new skin, which really eliminates a lot of that crepiness, a lot of those fine lines. So big fan of the laser. The other thing around the eye that you can do kind of short of that is like a gentle microneedling. I wouldn't do Secret Pro on the eyelid. You can do it on the lid margin, but not on the eyelid itself. For that, you could do like an Aqua Gold. So Aqua Gold it's a kind of handheld microneedler. So looks like a little bottle, and you put stuff in it. Usually it's PRP, like platelet-rich plasma. So we draw some of your blood, separate out the plasma using a centrifuge, put that in the little reservoir, usually with a little bit of Botox, and we'll do like a hyaluronic acid booster to hydrate. You can do that on your whole face, and it's nice. But the nice thing about it is you can do it on eyelid skin. You can kind of pull the eyelid down, go all the way up to the lid margin. And that'll definitely give you some plumping and tightening with essentially no downtime and no trip to the OR. So that's a nice, easy one.
Yeah. And the CO2 is great, but the downtime.
Yeah. I mean, that's the thing. I mean, like there's no such thing as something for nothing in this world. And especially in the world of making you more beautiful. So CO2 laser, so the Secret Pro, as luck would have it, has 2 heads on it. One is the microneedling with radio frequency, and the other piece of it is a CO2 laser. And we'll use them together. In an awake person, we'll do 2 passes with the microneedler, and then we'll do 2 passes with the CO2 on a gentle setting. So it's kind of a selective, gentle peel of the outer layer of the skin, and you'll get a nice result from it. You'll be a little pink for a day or 2, depending if you have it down real low. Got to be careful about sun exposure for about a week. Can't do it if you have dark skin, but produces a nice effect. You can also turn the CO2 way up. We do it like when I do a facelift on somebody, we'll add that on to most of my facelifts, treat the entire face, treat the eyelids, treat the neck, and you look pretty cooked afterward. But you're recovering from facelift anyway. You're just hiding in your apartment for a couple of weeks.
True.
So, as you recover from surgery, you slough a layer of skin from the outside. You're red, sure. You got to be careful about sun, but by 2 weeks after, you look awesome. And it's not something you're going to do more often than once a year, maybe once every few years, but it's a dramatic effect. The more you crank it up, the more effective it's going to be. So like I said, you're not going to get something for nothing, but if you're willing to invest a little bit of downtime, you can get some pretty dramatic effects.
Yeah, because I want to come to you when the time is right, meaning like there's not a lot going on, and I want you to blast my chest, my neck, and my face. But I have to be prepared to not be seen for a week?
It's like, so a good week, you got to be careful. You're going to be pink red. It looks like, after it looks like you have a pretty good sunburn after a couple of days. The first day or so, you peel. But a weekend, you're gonna look a little pink. You're gonna look like you spent too much time in the sun. It's not terrible. But as we say, like this we're getting into laser season now. Like winter is
Yeah.
laser season. So, summer, you can do microneedling all year round. Like this is the time, like if you need to hide a little bit and want to stay inside, then yeah, absolutely go for it.
So, okay, so you do it's like 5 to 7 days, and then you're just pink. I mean, that feels like makeup could fix that. Or at least
You got to be able to carry. So if you've done a fairly aggressive laser, you don't want to put makeup on for a couple of days. Because
I was saying like after a week.
yeah, after a week you're fine. Yeah, after a week you can go and do things, and you're going to wear SPF anyway, like you should be. And yeah, I mean, especially if you're not going under anesthesia, we're not going to dial it all the way up. But we can do a pretty good treatment. We can give you a little oral fun medication, like we have these ketamine candies we can give you in the office, which just make you feel low dose. It make you feel a little bit loopy, make you feel a little bit happy, not really care that we're cooking your face. But no, it's nice. Between the numbing and the little oral sedation, we can go fairly aggressive and you'll be fine.
So but it seems like you're going to get more bang for your buck if you actually just go under.
Yeah, if you really, really want to do it, I can have an anesthesiologist give you a little bit of IV sedation even. If we're just doing that, if we're not doing surgery along with it, simple. The whole thing takes 20 minutes from start to finish.
That's crazy.
Yeah.
I know. But that is the key to like youth, really, right?
It helps. It certainly helps. Like I love a CO2 laser. I love an aggressive peel. So there are all kinds of peels out there, peels that do different things and are generally fairly gentle, something you're going to get by an esthetician or by a nurse. But if you do like a fairly hardcore, 30% TCA peel, that's going to give you something, and that's something that I would do myself.
Okay.
You shouldn't have anybody but a doctor do that to you. But that's going to give you a result kind of like a CO2 laser would, where it is actually taking off the external layer of skin and letting your skin regenerate. So yes, while there's recovery, you get serious bang for your buck because it's like new baby skin once you heal from it.
So, okay. So, and can you do that just under the eyes?
Yeah, we'll do TCA peel under the eye. Definitely.
And so that's kind of almost as effective as CO2 without all the downtime and the pain?
I probably wouldn't go quite as aggressive with the peel. But yes. Short answer is mostly yes. I like a TCA peel under the eye. I used to do a lot more peels before I bought this machine, honestly. And I'm like, oh, I got this machine. It's awesome. Let's do it. But before we got it, I was doing a ton of TCA peels. Yeah, no, it gives a great result.
So can you do that on your chest?
Yeah, you can. Yeah, you definitely can. There is I don't know about 6 of one, half dozen of the other, but yeah, you can do peel on your chest. It's fine.
Okay. So you can kind of do an aggressive peel or CO2.
Even if we're going to do the aggressive peel and you're going to be awake, yeah, we'd still do the ketamine candy. It doesn't feel good. It
probably stings, right?
Yeah, it's a similar discomfort level to the CO2 laser, honestly.
But it doesn't last as long, right?
Well, no, it does though. I mean, a good deep peel, absolutely. It's a deep peel versus aggressive CO2 laser. Yeah, it's like a once a year thing.
Oh wow. Okay. Yeah. So you can kind of do either or.
You kind of do either or. Yeah, I think of them kind of in the same. There's a lot of overlap.
Because we had talked about like my fine lines under my eyes were a concern for me. And you were saying you probably should do CO2, but if I can't afford the full downtime of doing everything, maybe just an under eye peel for now might be a good.
Yeah, that might be a reasonable option for you.
Yeah, so at least I can kind of get through and then do the Botox as well.
You're still gonna be red. You're still gonna be red. It's still gonna be red for a good week or so. But yeah, we do the peel just like with a Q-tip. I can be super gentle with it. It's like super precise. Sure. Happy
and then, oh, thank you. And then how long does it take to peel?
You're going to peel over the course of the next couple of days.
Okay.
You walk out of here, it's kind of frosty white and then turns red. And then you get the peeling over the course of the next 2 to 3 days. And then it's just kind of pink and then it heals and you're good.
And so it makes a difference with those fine lines.
Oh yeah. Oh no, it's great for fine lines.
And then you can do it on top of Botox if you've had it.
Yeah, Botox is treating something totally different. So like the peel or the CO2 is treating the surface of the skin. It's kind of peeling off a layer of the surface of the skin. Botox is treating the muscle that's underneath, that's making the contraction that makes the wrinkle.
Yeah.
By just relaxing that muscle, in this case, it's the orbicularis muscle, which has these little fine wispy fibers that run all across your eyelid. By chilling that out, it just makes it so you don't scrunch, and just relaxes the wrinkle. So yeah, they work in conjunction with each other. Botox treats from the inside, and the peel or laser treats from the outside.
Okay, so probably a good thing to just do at the same time.
Sure, absolutely.
That makes sense. Okay, let's talk about Botox, because everybody is doing Botox. I feel like people are starting younger and younger and younger, and there's a lot of stuff going on around there. How often should you do it? Why doesn't it last that long? And what's up with this new Botox that hasn't hit the market yet that's supposed to last longer?
It has hit the market, but I'll get to that in a second.
Okay.
So Botox is great, and yes, it's becoming more socially acceptable for younger and younger people to do it, and it's great for me, but I believe in it. It is a very effective medication. So Botox is it's a protein produced by the botulinum bacteria, which in high doses, causes botulism, makes so you can't breathe, and does bad things, and you don't want to get poisoned. That said, the molecule itself is blocking the contraction, the signal from the nerve to the muscle at a cellular level, and it blocks the molecule permanently. And the way the effect wears off is you make new ones of that molecule. It's how long it takes to wear off, how long your body takes to do that is usually about 3 to 4 months for it to completely kind of run its course. There is some variability from one person to the next. Like if you have more muscle mass, if you have just a higher baseline metabolism, you'll tend to turn it over faster. So how often should you get it? If you want to keep the effect, every 3 months is a good rule of thumb. Quarterly to 3 times a year, depending. I tell people to not let it wear off completely.
I was about to ask you that. Like, do you want to have it wear off to where it's like completely gone, or just the 3-4 month mark?
What do you want to look like is the thing. I mean, if you let it like fully reach its end, yeah, you're going to be forming some wrinkles. If you don't, you're not hurting yourself by doing it a little bit earlier. But I usually say, wait 3-4 months. When you start to see it, like noticeably your face is moving more, the areas are moving more than they were before, more than you'd like. Yeah, then pop back in. And a good rule of thumb is, 3 to 4 times a year, just keep it in the back of your head. But no, you don't have to wait till it's totally gone.
So you don't do the same amount each time. You just do it based on what the patient needs at that moment.
I mean, I do. What that often amounts to is the same amount each time.
Okay.
So yeah, I always look at what I've done for that patient before, and I will typically do the same. Sometimes we'll dial it back. Every time you come into my office, I'm going to look at you and see what I think you need. But yeah, I mean, it usually ends up around the same.
And it's so crazy because it's so common.
Yeah.
And there's more stuff coming out. Okay, so what's the difference between Botox and Dysport?
Okay, so there are a bunch of these products out there. So there's Botox, there's Dysport. They're made by different companies. There's Zuckerman, there's Jeuveau, and now there's the new one, Daxxify. So they're all made by different people. They're all with the exception of Daxxify, they're all slightly different variations of the same molecule. It's a protein that has this or that little sequence change, so it gets around the patent. So Botox was the first one that's made by Allergan. They're the first people to put it out there, and it's been around for 30 years at this point. Dysport came around a little bit later. That's made by Galderma, the same people that make the Restylane fillers and Sculptra and a bunch of other things. And it's a great product. I will use it interchangeably. Some people I carry both of them in my office. The Dysport people, the rep will come in and say, "Oh, it kicks in faster. Oh, it lasts longer." I've had them all in my face at one time or another. I think Botox and Dysport are roughly equivalent. Again, if somebody has a preference, I'll use one over the other. They cost me about the same, so I don't particularly care either way. The other two, so Zuckerman and Jeuveau, those are the new. Those are slightly newer, within the last 5 or 6 years or so. Again, made by different companies. They're slightly cheaper. I feel like they don't last as long. Just anecdotally. Again, the Zeman people were giving us a whole bunch of free product for a while, so we were giving a deal with surgery on Zeman. But given my preference, I wouldn't use it. I don't think it's as good. And Jeuveau is kind of like, yes, us too. The Jeuveau people have a nice thing where if as a provider, if you buy enough of it, they'll put you on a billboard in Times Square, or they'll put you on the side of the Hamptons Jitney bus. So that's their big claim to fame, and the product is fine. So Daxxify is the new one, and that was the one that was in the pipeline for a bunch of years and finally got approved. Came out just shy of a year ago, available to kind of a select group, and then available to more of us a few months later. I was in the second wave. I didn't buy enough of the stuff from the company to be one of the early adopters, but I like it. So the difference with that one, instead of being a whole protein, it's a smaller molecule. It's like a piece of the Botox molecule. Why that makes it last longer, I didn't pay close enough attention to the lecture when they talked about the science behind it. It's like, all right, I get the point. Fine. That's it. It does last longer. So I tried it when we first got it, and it was in my face for a good 6 months before it recently wore off. So yeah, it kicks in faster and absolutely lasts longer. It also costs more. So it's a nice option that we offer to people. So the people who forget to come in for their Botox every quarter, it's like, oh yeah, I should have seen you 3 months ago. It's nice. Or like, I live way the hell out in Jersey, but I like coming to you. It's for those people, and it's great. So yeah, it kicks in about 3 to 4 days, and yeah, I got a real 6 months out of it. So they say up to twice as long. We charge about 1.5 times as much money for it, which is, I think reasonable. But yeah, no, it's good. I like it.
Okay, interesting. Yeah, I remember I went to an open house with my sister-in-law at one of her med spa in Denver, and they were doing all these weird, like, you could walk into these different rooms and watch people get like lip filler and tear trough filler and it was a bizarre thing. And there was like family members that were like volunteering, and there was all these legal things. It was strange, but I asked about the Daxxify, and the woman was like, yeah, it's coming out, but everybody's afraid to use it because if you drop an eyebrow, it's dropped for a lot longer.
Well, don't drop an eyebrow, dude.
Yeah, right.
Like, with any of this stuff, yeah, sure. Are you going to look strange for 3 months? You're going to look strange for 6 months. That doesn't happen that often with an injector knows what they're doing. And the world of this stuff, like the Pandora's box is kind of opened, and what has become the standard for getting injectables is, I go to this or that med spa, and then these chains of med spas run by usually not a doctor.
Yeah.
That the people injecting you, they might be a physician assistant. They might, not to like, there are plenty of physician assistants and nurse practitioners and nurses who are very competent injectors, but the level of supervision is not necessarily there. Or you might be injected by somebody who's truly unqualified to be injecting you. You just don't know what you're going to get.
Yeah.
So this stuff is user dependent, and you can make somebody look strange. It's hard to really hurt somebody with Botox, but you can definitely create some effects that people aren't going to like. Never mind dropping somebody's brow, you drop somebody's eyelids, you're walking around with your eye half closed for 3 months. So yeah, there's somebody who knows their anatomy, knows they're doing. An idea that should be like plastic surgeon, dermatologist, people who are truly trained how to do this stuff. That's kind of my soapbox thing on this, but it's, it is so poorly regulated now. They kind of let anybody do it, and the government casts a blind eye on it. They have bigger fish to fry. So, but it's, to your other
It's
point.
True. My experience with med spas. I'm sure it's fine if you're just doing a basic microneedling or some hydrofacial, but that I went to quote unquote med spa, and you had to fix my lip because I look like a freak.
It looks good now.
Thank God. It looks normal now. It's like
happy to provide normal.
It's like lesson learned.
Lesson learned. The thing is, you go to these places, you're probably going to be okay, but you might not. Your chance of not being okay is much higher than if you go to somebody who's legitimate. And that's the thing. And with younger and younger people getting it, getting these treatments, there is value in, charging less money and having kind of a glitzier presentation, and going to a place where they don't call you a patient, they call you a client. Kind of separating the medical aspect from it, and you go to this kind of not that my office isn't very pretty.
It's very pretty.
Thank you. But yeah, it's like having a pretty space, having a pretty girl who has great social media presence, injecting you with, might be Xeomin, might be Jeuveau, they're going to call it Tox. You might be okay, or it might suck and you might come see me. So that's my take.
I think that one of the things I because I told you about a friend of mine, but I think it's when you're doing things that change your facial structure, like fillers, you should just go to a doctor, like an actual doctor, like yourself, and not like because they can make you look really weird. So let's talk about what you had to fix on me, which was the lip filler. Lip filler doesn't look good on me. I tried to think like, oh, it'll make me more youthful. It made me look like a freak, and now I look normal again, thanks to you. But more and more girls are getting this, and I'm saying girls because they're so young, are getting this. And my concern is that they're stretching out the skin, so they're going to have to do it for life. Like that skin is going to be like, what do you think? Is that?
It's not so much that. The amount of actual, stretch on the skin that's happening there isn't that aggressive in the average person who's getting lip filler. You're not gonna 20 years down the road have floppy lips because you had so much like getting breast
saggy lips
like that. Yeah, exactly. Like that's not really a thing. But lip filler does accumulate, so it's you'll inject it, and I'll have people who come back a year later, 2 years later, 3 years later, and there's still a residual filler in the lip. So even though these fillers are made of hyaluronic acid, which is something that it's a component of all of your tissues. It's something your body makes, and your body naturally breaks it down. It doesn't 100% get broken down in a lot of cases. So many people come to see me, they've had lip filler like you did, or had lip filler a long time ago and thought it wore off, then got some more lip filler, and now it started to look weird because they have that filler migration, that filler bleed like along the edge. So what a lot of injectors will do, and what I'll do if somebody's never had lip filler, is inject right along the border of where the pink and the white meet to accentuate that line and to roll the lip out a little bit. It's a nice way to like highlight the lip. That said, if you still have filler in there and you come in to get more filler, injecting it in that same spot is a guaranteed recipe for having that filler just kind of bleed outside of the lips. And you'll see that telltale ridge above the upper lip of just stuff. And that's filler migration. And that's a product just getting too much filler, getting filler too often. And, having an injector who's just not judicious about it and like looks at you as, yeah, sure, more filler. And I'm going to do filler how I do it every single time because, when all you have is a hammer, everything looks like a nail. So yeah, you got to be careful if you don't want to look strange. That said, judicious lip filler done right can make in the right patient, done right with the right product, and like not doing too much, not doing it too often, it can look great.
Yeah.
But it's something that's easy to screw up.
Yeah, that's why I done it like twice, and I'm like, I think I might just look better natural.
Your lips are great. I mean, I look at you now, like perfect. Like
Like I'm like, oh, do I need more here? But it's like, no, I'm not messing with it again.
No, not at all. You have a nice shape. Your appropriate ratio. Upper lip is a little bit smaller than the lower lip, which it should be.
Yeah.
No, lips are awesome. Stay away from the filler.
Yeah, exactly. Right. Yeah. They're like, do something else. I'm gonna do the peel, and then the CO2 eventually when I get out of balls. I'm like, oh my gosh. Did you know, I learned this, that the skin on your lips is the same skin on your asshole?
Yeah. So yeah, in a lot of places, it's like your asshole or like your labia, for example.
It's weird. It's so funny.
Similar stuff. So like it heals faster. That's part of these are areas that are also like the inside of your mouth, some similar stuff.
Yeah.
So like I like to tell, so among many surgical procedures that I do, sometimes I do labiaplasty. It's another conversation for another time. But what I tell people is it heals incredibly quickly. You do a bunch of surgery down there, and by 2 weeks later, it looks freaking great. Because it's the same deal. It's the same type of tissue, whether it's your labia, your lips, your butthole, where it has a very high rate of cell turnover, and it just heals quickly and relatively scarlessly. So yeah, cool, fun fact.
Yeah, no, it is, right? I was like, oh, that's interesting. I didn't know that. So I guess the color of your lips is actually the color of your asshole. Fun fact on the podcast. You know what I mean? All right, what was the other thing I want to talk about? Because you are a plastic surgeon and you help women and men feel amazing about themselves, and it's great. But I want to talk about some of the downsides of plastic surgery. Like, when do you refuse to operate on a patient?
When they give me crazy vibes. No, but that's, yeah, sure. I can say that, but it's, it can be hard to turn somebody down when they show up in your office and say, I want to give you a bunch of money to make me feel better. And you're a surgeon and you know how to do things. Yeah. So that's like at baseline. Yeah. That's what I'm trying to do is get people to have surgery with me. Red flags are people who've already had too much surgery, people who've been operated on by a bunch of different surgeons, people who've been turned away by other surgeons for this or that reason. But I also just look at every patient and, try and assess whether what they're asking for is reasonable and if the change they're trying to make is reasonable. In the vast majority of cases, it totally is. But anybody who's come to see a plastic surgeon, anybody who's getting any of these treatments, be it the non-surgical stuff or surgery, spends a little bit of time looking at themselves in the mirror, and is going to have something about themselves that they don't like, and that can be like, oh, I really, I wish I didn't have a big tummy, I want to fix that, or like, I have this little thing that I see that nobody else sees, but I can't stop thinking about it, and I can't stop looking at it. That's when it bleeds into the like, oh yeah, maybe I shouldn't touch you. So I want to, I always have a conversation with people when they come for the consult. I spend a good amount of time and try and make sure that our visions are aligned and what they're looking for is something that I can legitimately provide. And, try and be very transparent about what I can do with what they're presenting to me. So, it's, I don't have time for the headache. It's not worth, it's not worth all the money in the world if you're just going to be unhappy and torture me and go on the internet and tell the world how terrible I am. It's just not worth it. Keep your money and go somewhere else.
So how often do people bring pictures of celebrities into you and say, I want this?
Like, in that way, not that often. People bring inspiration pictures all the time. And I think that's useful. Like saying, make me look like Brad Pitt, make me look like, J-Lo. Like that's not useful, and it's never something that's going to be productive. And most people are mostly reasonable. But I do think it's useful when patients, bring me pictures of, oh, I really like these breasts, I really like her breasts, or I really like her butt. Like, what can you get me something close to that? So yeah, I love inspiration pictures and say, okay, this is what you've got, and this is what she looks like. I may not be able to get you exactly that, but I see what your aesthetic is. I see what you find attractive. And it's good to help spark conversation and help kind of drive us to where we're trying to both get.
Yeah, no, that makes sense. And you must have seen such an uptick with the whole rise in Zoom and also the rise in social media.
Yeah, I mean, our like, so the COVID times, like, it was a strange time, but a huge boon for my industry, at least in the relatively early phases. Now things have kind of returned. I mean, the world has kind of returned to pseudo normal, and my industry has kind of returned to mostly normal. But for about a year and a half in there, everybody was getting this stuff done. Every other plastic surgery. I mean, I was busy beyond belief. I mean, as was every one of my plastic surgery colleagues. I mean, there was just so much is being done. Everybody was locked up at home. Everybody's staring at themselves on a screen, just like you and I are now. So yeah, you pick out the things you don't like. It's staring you in the face every day. And I'm locked up at home anyway. I still have a job. I'm not traveling anywhere. So yeah, what better time to get plastic surgery or get my face lasered or get lip filler. And so yeah, I mean, that was all great. it's like I've said, it's cooled down a little bit as the world has gone back to the office and things like that. But yes, Zoom lockdowns has all been a huge boon to my industry. Now, social media,
Yeah, that's a whole nother.
it's a whole different can of worms.
So you obviously know TikTok. You use TikTok. When you go on TikTok, even when you turn that beauty filter off or any of those filters, you look different.
Yeah.
Nothing on TikTok is real.
Oh, I know that. TikTok is not my favorite social media modality, and maybe I'm just showing my age here. But yes, all of social media is giving people kind of a warped perception of what they're supposed to look like.
Yeah.
And it's that said, don't let keep your kids off social media. Now, as somebody who has, I mean, my children are small, but I worry. I mean, I have a 4.5-year-old daughter. I don't know what the thing is going to be when she's a tween.
I know.
But yeah, no, it's scary stuff. Just this kind of pressure that's created from this false sense of what you're supposed to look like and what you need to look like and what this celebrity or that celebrity looks like. In real life, those people don't look like that either.
Yeah.
It's well, on the one hand, it's been it drives people to my office. Yeah, great. But there's this kind of collective insecurity that's created, which is really unfortunate.
Well, I think people are afraid to age. Yeah. It's good to maintain and do the things that make you look good and feel good, but I think there's an inherent fear now about aging and having an expiration date, especially for women. Yeah. And that's why I think there's but I think there's also embracing who you are but that's why I like the stuff like The Secret that you did, because it's not changing your face shape, it's just making you look more youthful naturally.
Yeah, it's like a TikTok filler TikTok filter in a machine.
Yeah.
No, I mean,
good call.
Yeah, I mean, all kidding aside, yes. Yes. I mean, I respect aging gracefully. Absolutely. I mean, I look at, look at my dad. He's a super handsome 75-year-old guy, and he's never done anything. Barely even puts on sunscreen. It's different.
He's blessed.
Story. Yeah. Hashtag blessed. But it's so yeah. I mean, I respect that, and there is value in that. And there's value in just feeling good about who you are for what you are. But I also don't see particular issue in doing things to help yourself feel better about yourself. I mean, obviously it's what I do for a living. It's kind of, you got to check yourself and make sure you're not going crazy. Make sure you're not going over the edge with it. But I mean, I think, a healthy sense of, yes, I should put sunscreen on. I should, keep myself looking reasonable, and just looking healthy and being healthy. I think there's real value in that.
Oh, absolutely.
Do I see a problem? I mean, yeah, so sure. If you feel comfortable getting a little bit of Botox and getting a laser, and and you look great and you feel great after that, awesome. Like that's a win for everybody. If what you need is a facelift to feel good about yourself, then yeah, sure. Facelifts are awesome.
What's the average age for a facelift these days?
Getting younger.
Younger, like 41, my age?
No. I mean, people do it. I've never done one on anybody. I think my youngest facelift was probably 52, 51, 52. But there are guys out there who crank these operations out who are doing them in people in their 40s and late 30s, which I think is crazy. I think that's excessive. But the average facelift, like the ideal time to get a facelift, is probably late 50s.
Okay.
Where you're mid to late 50s, where everything hasn't kind of gone to hell yet. You've definitely started, especially in women, at post-menopause, where you really start to lose collagen and lose volume and lose skin elasticity. When that starts to go, that's when you start to get the sinking of the cheekbone, the sinking of the jowl, and kind of hollowing of the cheeks. And those are problems that are best addressed by surgery. And late 50s is kind of your sweet spot where you're definitely healthy enough to undergo surgery without batting an eyelash. And where you're going to get, your tissues are still of good enough quality where you're going to heal beautifully, and you're going to legitimately look 15 years younger after you do it.
Wow.
You're not like, because people in their 70s get these too, sure, but you tend to look, you look younger, but you look a little bit like a 70-year-old just had a facelift.
Because they waited too long?
Yeah, exactly. Just the quality of the tissues isn't as good. You've lost more. Even pulling on the skin itself is still the same stuff. Still made of the same collagen, same elastin, which isn't what it used to be 20 years before.
Interesting. So, and then how long does a facelift last?
10, 15 years. I mean, so sure I can say that, but don't think about it as like lasting. I mean, you're resetting the clock. You still continue to age.
That's true. That's a good
like
point,
done right. Yeah. Say you're winding the clock back 10 to 15 years.
And then how do you prevent like jowling to where you get heavier down here?
After you've had surgery or before, or like
me.
And so, I mean, tough. I mean, you can't 100% fight the clock. As we age, the natural volume that we have up high just descends. Things deflate, and everything tends to go down. So your cheeks get flatter in front, start to form these creases around the mouth, nasolabial folds, and that whole mass starts to descend below the jawline. That's what creates jowling. So how do you keep that from happening? I mean, stay out of this. So again, it goes back to the skincare regimen I talked about. So stay out of the sun, wear SPF, moisturize, things like that. And, collagen increasing treatments like the, RF microneedling is great. So Secret Pro, will do some skin tightening. It's not going to do real heavy lifting. The Morpheus people say, oh yeah, it lifts. None of these things will truly lift you. But I think a good deep RF microneedling will definitely give you some tightening. So you can fend it off a little bit with minimally invasives. Doing good skincare, protecting yourself from the sun. And then you can do things that camouflage it. So that's where fillers come in.
Okay. So at least like they don't have. So here's the thing that I thought, I don't know if I came up with this theory or I read it somewhere, but I think, so I don't run. I'm a lifter, but I will not run because I feel that running sags your face because it's like you're pounding. Like when you're jumping. Or did I just make that bullshit up?
You totally made it up. But I get where you're coming from. It's all just gravity. We're all subject to gravity, whether you're bouncing up and down. I don't think makes a whole lot of a difference.
Maybe that's my great excuse to not run.
Yeah,
I don't run because it sags your face.
Yeah, it's aging me. Yeah, I mean, being out in the sun, yeah, sure. But yeah, if you're gonna go running, yeah, wear a hat and wear a sunscreen. But or just go do other cardio. Do a rowing machine or go swimming or something.
Right. Yeah, that's true. That is true. Okay, well, this has been amazing. So tell people where they can find you, where they can follow you, all that good stuff.
All right, cool. So I'm in Manhattan. My office is located at 800A Fifth Avenue, Suite 101. That's the corner of 61st Street and Fifth Avenue, right on the park, right next to the Pierre Hotel, about a block from the Apple Store. On the internet, you can find me at zuckermanplasticsurgery.com, and my Instagram handle is Plastic Surgeon NYC.
Perfect. You guys, and if you're in NYC, go check him out. If you're flying to NYC, go check him out. I'm telling you, this guy's amazing. You're the only one that's going to touch my face.
Thanks, Madison. Love it.
I'm going to see you soon for a TCA peel under my
eye. Anywhere else you want.
Perfect. Well, you're the best. Thank you so much. I appreciate you. And I appreciate everybody who's listening, wherever you may be. We'll see you next time to find out who's next.
Hey, your host here, Madison Malloy. Please make sure to subscribe to the show on all podcast platforms, and please rate and review us on iTunes and Spotify. Also, if you have any questions or comments, you can email us at contact@nexttomadison.com. I thank you again for listening. Bye.